Hi, I'm Ben from Hands to Heart Massage, and today I'm here to talk to you about neck pain. The sort of neck pain I'm talking about is the one that gets deep into the shoulder blade or comes from the base of the skull and might give you a headache that comes over the top, and also that pain where you wake up in the morning and you're like, I can't turn my neck. If you're like me and like the majority of people, at some point you've experienced that sort of neck pain. So I'm going to go into the four main reasons why we get it, how you can actually affect it once you have the neck pain to help relieve it a lot quicker, and in that hopefully give you some techniques so that you can stop it happening more frequently. So the number one cause I see for neck pain is posture. Posture is a big one. Everything we do in life these days is forward. We're texting, we're at a computer, we're on our bikes, in our cars, we sit on the lounge and we watch TV. All those things contribute to what's called a forward head position. So good posture would say that your ear should line up with the shoulder, but generally from doing all of those things, your head creeps forward like this. And when it does that, it puts strain on the back of the neck. And it does that because, imagine this is your head or a tent and you've got ropes at the back and ropes at the front. Your neck does that. These ropes get tight. These ropes at the back are actually not tight, but they're under a stretch, like they're holding on like this, so they get really sensitive over time, and they're trying to do their job by pulling your head back. But by being in that position all the time, they're just continually under a tensile stress, a stretching stress. And so people will say to me, "Oh, I've got pain in the shoulder or the back of the neck. It's really tight. Can you work on it?" And actually, the key is to do a little bit of work on that, but actually loosen the ropes or the neck muscles at the front that contribute to you going forward. So, as I said, posture is a big part of it. With rounded shoulders and forward shoulders, it's nearly impossible to have your head back in this position. Naturally, it's going to want to migrate forward in line with your shoulders. So, a couple of exercises you can do to get your posture right, to get your shoulders back, to help your head come back. As a result, one of them is just a simple, and you can do this at your desk, it's just a hold for 10 seconds and then a relax. And so this is just 90-degree arms in line with your shoulders, not here, not back, but just there. And when you're doing it, the key is to try and engage the top of your shoulder blades to come together. You do that for 10 seconds and then relax and then do it again. If you're doing it at your desk, you might do it 3 or 4 times, every hour or 2 hours if you feel that way inclined, or at home you might just do a set of 10 and just get your shoulder blades, instead of, what it does, it actually teaches your shoulder blades, instead of wanting to sit out here, which they used to, is to just come back into their natural, normal position and just retrain that neurally to say, hey, this is where I should sit. Another one is to have your palms up and to draw your elbows back past your body and feel like you're trying to touch them behind your back. You're not going to do it obviously, but the key is then to feel like you're drawing the bottom part of your shoulder blades together. So that again teaches your shoulder blades, which sit out here, to be drawn back together into the middle. Another one is for your neck. It's actually strengthening your neck rather than stretching it. So a simple one to do is to just hold a little bit of pressure on the back of your head and just pull into your hands to resist that. It's not dropping your chin, it's not lifting your chin. You don't want to do that. It's like you're just pushing your chin straight back into your hands like that. That actually strengthens those muscles at the back to help bring the head back into alignment. You may also want to do this at work. You might look a bit silly, but it's a simple one, and it's just starting with your chin in a neutral position. You poke it out, you pull it in like you've got a double chin, and you let it relax. So it's not, again, dropping the chin, but it's pulling it back and relax. And that's where your head position should stay, and that'll also strengthen the back of the deep neck muscles. The other self-massage technique you can do to help release the front of the neck are these big. If you bend your head forward, you'll notice these big muscles here. They're called the sternocleidomastoid. And these ones are responsible for dragging you forward and turning your head left and right. And a good technique is just to pinch or hold onto them like that as you turn away from the muscle and look up. You might do that a couple of times. Make sure you do it to both sides just to balance it out. And that will give you a self-massage technique to help loosen those ropes on the front that will also assist with the strengthening you're doing to the back. So work on your posture, have a look at it. A good one is just to get someone to take a photo of you from the side, and you may see that, oh yeah, my head's sitting forward and that's not where it's meant to be, and just have a look at your shoulders, have a look at where they sit, and ultimately when you do that and you get into that position, you're going to have a lot less neck pain, because the distance between here and where those muscles attach is a lot less, and they're not going to be doing this anymore. They're going to be able to relax and do their job. The second place where I see people get a sore neck, and that's the one where they wake up and they can't turn their head, is actually how they sleep. If you're a tummy sleeper, you're not going to like it, but that's the worst position to sleep in, simply because if you're stuck like this for 4, 6, 8 hours, you wake up and you're asking your body to do that, it just gets locked into that position. It's like walking around all day like this. At the end of the day, if you just want it to be normal, it's going to be very tough to do that. Your vertebrae and your muscles get shortened on one side, lengthened on the other, and they just get used to staying in that position. So if you're a tummy sleeper, work on having a pillow there or something that stops you do it. Once you become unconscious, I understand it's hard, but if you've got a pillow or something that can stop you rolling onto your tummy to sleep, it's really going to help affect how your neck's going to be long term. The other one's pillows. Pillows last about 6 months. We keep them generally 2, 3, 4 years. Get a really good pillow, one that keeps your spine in neutral. So if you're on your side, so that your neck's not low and it's not too high. It just keeps your neck in a nice neutral position. I'm not advocating any particular pillow. I use a latex pillow because it lasts 15 years. I don't have to replace it. I find a pillow that's actually going to get your neck in a neutral position. The third reason why you might get neck pain is just bad technique, and that can come from gym work. It could even come from being on a bike for an extended period of time if you're doing half Ironmans and Ironmans. So it's really important if you're on your bike and you're in this position and that's not a natural position for your neck, just to make sure you get a bike set up, have it looked at by someone that can really do it, and get into a position where your neck's a little bit more in a neutral position, because when you're in an extended and flexed position for a long period of time, you're going to get a little few problems up into the base of the skull or right at the base of the neck where it meets down into your shoulders. Technique in the gym might be lifting or whatever. People tend to engage and want to lift things and use their head. Sit-ups is a good one. Instead of just tucking the chin in and using their core, they're coming up with their neck. So just, if you're finding you're getting a sore neck after exercise or the day after exercise, just pay attention to how you're doing things, because that can really contribute to the overuse of the neck, fatigue of the neck, and then you go and sit at a desk all day and they've already worked too hard and you'll end up with pain and imbalance in your neck muscles. The fourth one is breathing, and you go, breathing, how does that affect my neck muscles? I breathe all the time and I don't have a sore neck all the time. Well, if you look at these muscles here, when you do that, these are called scalenes, and these muscles are involved in breathing. So if you're anxious, if you've got a lot of stress, people tend to do a lot of breathing into their chest, not diaphragmatic breathing. And when you do that, these muscles get engaged to lift your ribs, the first and second rib, to help open up the lungs in the top part of your lungs. If they get overworked, they get tight, they really can restrict how you turn, how you flex your neck as well. And over an extended period of time, it'll reduce the amount of range of movement that you have in your neck. It can also affect, there's nerves that run from C3, C4 in your neck that run down your arm, and people come to me sometimes and they go, I've got a bit of pain, a bit of nerve pain down the arm, and it's generally referred to more up in this area where they're restricting the nerve running out of that C2, C3 down the side of the neck. So a point for that one is just have a look at your breathing. And what I get people to do is hand on the chest, hand on the tummy, and take a deep breath in and have a look at which hand moves. If you're finding that this one moves, the top one, your chest moves a lot, it means you're a chest breather, and predominantly you're doing all the work with these muscles. And all I say to people to do is just to focus, close your eyes, feel like you're drawing the breath down to your diaphragm. It's called diaphragmatic breathing. Check it out if you haven't, just YouTube it or Google it and have a look at what that means. They teach you that in yoga. But it's actually drawing the breath down deeper and not just using the top part of your lungs. So you'd do that, you breathe in and you'd feel this hand on your tummy actually expand first and foremost, more than your chest. And when you do that and get into a rhythm of that, it's going to take a lot more stress off these scalene muscles, which are involved in lifting the rib and give you a better range of movement in your neck. So that's it from me. Hopefully that's been a bit of an educational. You can take some of those things away to help with the pain that you have in the neck. Obviously if you've got it and you need some alleviation, massage is a great thing, heat's a great thing. See someone that can help you balance those neck muscles out and check them out. That's it for now. I'll catch you next time.